Hello, I'm Emily. I work in Paris, France at the EMN Enfants Malades Hospital. I am an orthoptist and I work in the ophthalmology department. And today I'm going to introduce you a study carried out in the neonatal intensive care unit of the Hospital of Reims, France. An estimated 40% of children are blind due to eye conditions that could have been prevented or managed if the child had access to quality eye care and screening services. Early detection of vision problems during childhood is critical. The earlier vision problems are treated, lower is the risk of total blindness. But it is not always easy for parents to detect a vision problem, especially since newborns naturally have blurry vision during the 3 first months of their life. Let me begin with a question. Do you know the first cause of preventable infantile blindness in the world? It's retinopathy of prematurity. But what is this disease which is generally unknown to the population? ROP is an eye disease that can happen in babies who are born early. And ROP happens when abnormal blood vessels grow in the light-sensitive layer in the back of your eye, called retina. To illustrate ROP, when the baby is born at full term, their retinal vessels have time to fully and properly grow throughout the baby's retina. On the other end, when the baby is born prematurely, the vascularization of the retina has not had time to complete. The thing is that the area will overreact to the lack of vascularization and overproduce vessels that can create traction on the retina and lead to its detachment. A preventive laser treatment can prevent this risk. You will have understood that ROP is likely to cause irreversible blindness. It is therefore necessary to have a quality and efficient screening. And you ask me, who carries out such a screening? Well, it's ophthalmologists. The good news is that the survival rate of extremely premature babies is constantly increasing. The bad news is that we are facing a worldwide shortage of specialized ophthalmologists, and it's therefore very difficult to meet the increasing demand for ROP screening. In turn, there is a solution to this shortage of training medical persons other than ophthalmologists. The study we are going to analyze today proposes a solution to this shortage by training orthoptists. Let's look at the method the scientists used to show how useful orthoptists might be in the screening of ROP. For the study, orthoptists had to screen all premature babies born before 35 weeks of absence of menstruation in the mother, or having a birth weight lower than 1,500 grams. For this, there is a very specialized device called ROP, which allows to come and look at the back of the eye of the baby. This device can be compared to a small camera that we put directly in the contact with the eye of the baby. The orthoptist tilt the camera in nasal, temporal, superior, and inferior to better observe the baby's retina and take pictures. This examination can be very impressive, but does not make the baby suffer in any way because before the examination, we put a drop of anesthetic to reduce the sensitivity of the surface of the eye. The fundus photos have been taken, the orthoptist had to make a diagnosis and classify the ROP according to specific criteria. This classification is essential because it will determine whether the child will need preventive treatment or not. Sum up, the study was conducted for 1 year from September 2001 to 2002. During this period, orthoptists screened 145 babies, 8 were at risk of complication and were referred to ophthalmologists for possible laser treatment. Finally, only 5 of them received laser treatments. Consequently, the training of orthoptists who are experts in prematurity is an ideal response to the lack of ophthalmologists because it allows them to meet the growing demand for fundus examination in premature babies, whose survival rate is increasing. The orthoptist performs the fundus and refers the babies to the ophthalmologist only if a preventive treatment seems necessary. This is a reorganization of the premature screening system that allows each baby to receive the necessary number of fundus examinations in a required time. In addition, the premature child is at risk of developing visual disorders. Currently, the orthoptist had a place of choice in the follow-up of premature baby because he performed a visual examination at 9 months, 3 years, and 5 years of age, which allow to evaluate if the child has a squinting eye, strabismus, or a lazy eye, amblyopia, or need for glasses for refractive disorder. Having screening in premature baby would therefore be in perfect continuity with his practice. Thank you very much for your attention.